My name is Alice Schmidt-Hambidge, pronouns she and her, and I'm scientific co-director of the KDE Hub, along with my co-scientific director, Colleen McMillan. And we'd like to welcome you here today. Great to see so many people here in our webinar. And we're thrilled to be sharing this webinar together with our friends at the Public Health Agency of Canada. And we will introduce them shortly. But before we begin our webinar presentation today, I'd like to acknowledge the land that we are on today. The KDE Hub, we're located at Renison University College at the University of Waterloo in Ontario, which is on the ancestral unceded territory of the Anishinaabe, Haudenosaunee, and Attawandaron peoples on the Haldimand Tract. This land was promised to the Six Nations, and it includes 6 miles on each side of the Grand River from mouth to source. I acknowledge that where you're listening from today might be different, on a different territory, and I invite you to offer your own land acknowledgement and indicate where you're listening from. This week and the days leading up to the National Truth and Reconciliation Day on September 30th, offer us another reminder of the importance of remembering the many tragic and reprehensible harms caused to Indigenous peoples in this country, and to create awareness of the intergenerational impacts of residential schools. It's also an opportunity for us to reaffirm our commitment to acts of reconciliation in our workplace and in our communities, not only now, but throughout the year. I pay my deepest respects to the Indigenous elders and knowledge keepers of communities across Turtle Island who may live here today. And I'm grateful to have the opportunity to live and work on this land, and I honor the teachings about the earth and all our relations. The topic today for our webinar with our colleagues from the Public Health Agency of Canada is to explore Canada's positive mental health surveillance indicator framework. We're really excited for this presentation, and we'll provide an overview of measuring positive mental health in Canada across different ecological levels. I also want to assure everyone that this webinar recording is being recorded, and that slides will be available soon after the presentation, and we'll also create an event brief for you today. I would like to welcome Shannon Bradley Dexter, who is a senior policy analyst who works with the Mental Health Promotion Innovation Fund with the Public Health Agency of Canada, and she'll introduce our lead presenters today. Over to you, Shannon.
Thank you for your welcome, Alice. It's with pleasure that I have the opportunity to introduce your speakers today for the webinar and also provide a bit of context. First, I want to acknowledge that I'm living in the traditional territory of the Tsleil-Waututh, Musqueam, and Squamish First Nations in North Vancouver. And it's an honor and a privilege to live in this unceded territory. And thank you, Alice, for acknowledging that it's the week leading up to the National Truth and Reconciliation Day. There are lots of conversations happening in our house with our children. So yes, thank you for that acknowledgement. So my name is Shannon Bradley Dexter, and I work directly with the Mental Health Promotion Innovation Fund, primarily on knowledge mobilization. And that includes our partnership with the KDE Hub. As you may be aware, the Mental Health Promotion Innovation Fund is a strategic funding model that really has 2 main objectives. The first is to fund the community-based mental health promotion programs that promote change at individual, community, and systems levels towards health equity. And the second is to fund project research and evaluation so that we can gain new knowledge in the field of mental health promotion and share it with other practitioners across Canada. So it's through forums like this, such as this webinar, where we can all come together. And I know we have representation today from other FACT-funded programs, such as those that are supporting the mental health of those most affected by COVID-19. And there are also CIHR-funded projects through the Mental Health in the Early Years Initiative. And this webinar is really in response to your interest. We know that you expressed interest to the KDE Hub team to learn more about what FAC is doing and what's happening and how does the positive mental health surveillance indicator framework work and where might there be connections to the work that you do. So you'll see as we go through the content today, there are so many connections to be made. Whether you're joining from a community-based organization, a government body, or a university striving to make that change at multiple levels for mental health promotion, there are insights from surveillance data and from indicators in the data tools. So I'm also excited to tell you that both the Innovation Fund and the Positive Mental Health Surveillance Indicator Framework, alongside other international examples, will be profiled in an upcoming report by the OECD. And this report is on supporting societies to thrive and to promote well-being, and it will be launched in mid-October. If you're interested in receiving copies of the report, more details will be available through the KDE Hub. So with that, it is my pleasure to introduce to you my colleagues from the Public Health Agency of Canada and your presenters today for the webinar, Dr. Heather Orpana and Karen Roberts. Dr. Orpana is a senior research scientist in the Center for Surveillance and Applied Research, as well as an adjunct professor at the University of Ottawa. Her research focuses on population mental health, including its intersection with mental illness, suicide, and substance-related harms. Measurement is one of her favorite things. And Karen Roberts is a manager in the Center for Surveillance and Applied Research. Karen leads the team that's responsible for positive mental and healthy living surveillance. Her team oversees a range of national frameworks, including the Positive Mental Health Surveillance Indicator Framework, the Physical Activity, Sedentary Behavior, and Sleep Indicators, and the Canadian Risk Factor Atlas. So as you will see through the presentation, Karen and Heather have a wealth of knowledge in the field of national population health surveillance. And they're interested to learn from you, as it really is this bi-directional relationship between what is happening on the ground to advance mental health promotion and well-being, and how that change is captured at the national level where we see collective progress. So thank you, and over to you, Heather and Karen.
Thank you so much, Shannon, and I'm thrilled to be here today. So I'm here today to talk to you about the Positive Mental Health Surveillance Indicator Framework, along with my colleague Karen, as well as Melanie, who's behind the scenes helping us to navigate. First off, it's really important that I acknowledge that I'm joining you today from the unceded territory of the Algonquin and Anishinaabe people. I'm tremendously grateful to benefit from living on this beautiful land, and I reaffirm with this information my commitment to be mindful that I am an uninvited settler on these lands, and therefore have a moral duty to actively work towards reconciliation. So thank you, Mother Earth.
So just a quick slide here on the goals of public health surveillance. And as noted in the 2021 CPHO report, the first step for understanding any public health issue and a prerequisite for public health decision-making is information on the health status, health risks, and determinants of health for the population of interest in key subgroups. And it really is surveillance that generates the evidence that can inform our actions. So through the work of the Public Health Agency, we're seeking to provide the right information at the right time for our key audiences, which include federal, provincial, territorial, and local government decision makers, health system partners, communities, researchers, and even the public we often include as one of our key audiences. And so the surveillance information we produce, we're hoping is directly informing the actions that we're taking, and as we try and enhance the health status of populations, protect against and mitigate the impacts of emergencies, as well as to achieve equitable health outcomes across all population groups. Next slide, please. So as some of you may know, routine surveillance is often illustrated as a cycle of steps through which data are collected, analyzed, interpreted, and findings are disseminated to inform action. Hopefully, generally, this is followed by some form of evaluation or check-in to be sure that the system has achieved its goals. So key pieces in this cycle include the establishment of clear objectives, the identification of meaningful indicators and measures that will form the basis of monitoring and reporting. And an indicator framework like the PMHSIF, about which you're going to hear lots today, really does provide the structure for surveillance work. And it helps ensure that the information that we are collecting is going to inform health promotion programs as well as policies.
So I'm probably speaking to an audience who has already made a journey to understanding the importance of positive mental health and well-being. But just in case we have any newer friends along this journey, let's take a few minutes to talk about what positive mental health and well-being is, what it isn't, and why it's important. I suspect that we all know intuitively that mental health is an important part of our overall health and well-being. Sometimes, though, our language trips us up. So when we say mental health, or when we hear mental health in the media, what do we actually mean? In the mainstream discourse and even in the health domain, the term mental health is often used to represent a really broad range of concepts, including both negative states like distress or mental illness, as well as positive states such as positive mental health and well-being. And both of these are very important. However, historically, much of the research as well as policy focus has been on negative states, such as mental illness. Um, so I think, however, that we would all agree that positive mental health and well-being are incredibly important, both for individuals as well as for society. And if we all take a moment to reflect, previous slide, please. Thank you. Like what is most important in your life to you as an individual? And I suspect your answer may be something along the lines of, okay, I want to be happy. I want to have meaning and purpose in my life, and I want to have positive and healthy relationships. Your answers might be a little bit different than mine, but there seems to be some good consensus in the literature that these are very important things for many human beings. So this is why positive mental health and well-being is so important. Foundationally, it is at the core of what is important to many of us. If we want to explore formal definitions, both the World Health Organization and the Public Health Agency of Canada have definitions of mental health that are grounded in a positive and well-being perspective. And both of these definitions highlight what we are aiming towards and not what we're trying to avoid. Next slide, please. Sometimes, unfortunately, back one, positive mental health is framed as the absence of mental illness, or mental illness and positive mental health are framed as two ends of a single spectrum. Even in the 1950s, theorists identified that this approach was problematic. One could be living without a mental illness and still have a miserable and unfulfilling life. In contrast, someone could be living with a mental illness, and I suspect a good proportion of us here today have some experience with this, and yet still have some level or even high levels of positive mental health. Next slide, please. So this idea of a single continuum then was morphed into this idea of the dual continuum, which is generally attributed to Dr. Corey Keyes. The dual continuum model proposes that positive mental health and mental illness are two related but separate axes. The dual continuum model is often presented as that first figure with the two axes being unrelated or orthogonal. But in reality, they're more like correlated axes where we know that there's some association between the two, but they're distinct concepts. We also have really good data in Canada that people living with a mental illness can also experience high levels of positive mental health. In the graph that we present here, the red bars are the proportion of the population with excellent or very good self-rated mental health, and the black bars represent high life satisfaction. The three groups presented are people with both a mood and anxiety disorder or a mood or anxiety disorder only. And we can see that even among the population living with one or two of the most common mental illnesses, a high proportion of this population still reports high levels of positive mental health. Next slide, please. So in 2013, the Government of Canada identified a need to enhance data on mental health, and we identified an absence of systematic data on positive mental health. Because of this, the Public Health Agency of Canada developed the Positive Mental Health Surveillance Indicator Framework, which followed a structured approach to identify which concepts should be included in such a framework, identified indicators for those concepts, measures to measure those indicators, and then data sources. Also important to note is that we started off with an adults indicator framework and then moved on to youth. And Karen will tell you a little bit more about our life course approach. Next slide, please. So probably my favorite infographic in the whole universe. You can see here the results of the process, the Positive Mental Health Surveillance Indicator Framework conceptual model. Broadly speaking, there are positive mental health outcomes, which you can see along the top of the infographic. Self-rated mental health, happiness, life satisfaction, psychological well-being, and social well-being. Below those outcomes, you can see risk and protective factors, which are framed in a socio-ecological framework, and for which there are indicators at the individual, family, community, and societal levels. Next slide, please. So positive mental health outcomes are really a central feature to this framework because it's what we're working towards. We want to improve and enhance the positive mental health of the Canadian population and decrease inequities in positive mental health. Based on the literature at the time, we adopted a three-factor model of positive mental health outcomes, which included emotional well-being, also sometimes called hedonic well-being or feeling good, and psychological and social well-being, sometimes called eudaimonic well-being or functioning well. I've snuck this in. It's not part of the original model, but I've really begun to wonder whether we need to add a fourth dimension here, ecological or environmental well-being, which could be something like a sense of connection to, an ability to have a positive relationship with the natural environment. And I think it's really important to acknowledge that frameworks and conceptual models like this, we socially construct them. And so they're going to be changing over time as we as society evolve. I'm very excited to see where this framework, how it evolves in the future. And now I'm going to turn the presentation over to Karen, who's going to take you through the framework and related data tool. This is really cool because a framework is nice from a conceptual perspective, but the associated data tool really brings the conceptual model to life by translating concepts into concrete indicators and measures. And we know that when we measure something, people pay attention. It makes the concept real for them and it stimulates action. And I think that's really been the success of the PM-HSIF. Thank you so much. And Karen, over to you.
Thank you, Heather. So we were going to start this with a poll. I'm going to suggest we just keep going. I was going to do a little poll to see how familiar everyone was with the PM-HSIF. Hopefully it's not new to everyone and there's some familiarity with the framework, but if not, I hope the next set of slides are helpful and give everyone or those who don't know an introduction to the tool. So returning quickly to the development process for the PM-HSIF that Heather showed us briefly earlier, what I wanted to highlight was I think it's the 7th step in the list, which is the knowledge development and exchange, or KDE step, as well as the steps that follow. And so a key piece of that KDE plan was the development of an online interface that would allow for easy access to data and information, which, as Heather said, right, really is what brings something like a conceptual framework or a conceptual model to life. So moving on to the next slide, what you will see is just a quick screenshot of the Positive Mental Health Surveillance Indicator Framework. And this is the platform as it appears on our public health info base. So today, when we speak of the PM-HSIF, we're generally referring to this info-based platform. And Melanie, I'm assuming you're just going to flip over. We're going to see if we can do a quick live demo here instead of using our canned screenshots, which are going to be included in the deck. There we are. So there are 3 key areas on the PM-HSIF's info-based page. At the top, you'll see 3 tabs there. We have a data tool, we have a quick stats tab, as well as a publication tab. And these different tabs allow users to get access to data products, as well as information stemming from our PMH-SIF indicators. So starting on the front page, all the way to the right, you'll see there's a little screenshot. That's a screenshot of our quick stats documents. And the quick stats are downloadable PDF documents that provide national estimates for every indicator in the PMH-SIF. There's a few under development that you'll see, but for everything for which measures and data sources were identified will appear in the quick stats documents. There is a document for youth as well as a separate document for adults. And as Melanie's showing here, with one quick click, you can get this easily printable document containing your high-level stats. Back pre-COVID, we always used to suggest that people print these out and tack them up in their office. Now I think many people have multiple offices, so feel free to print out multiple copies. Our goal when we initially put this out was that some of our senior management would stick those up on the wall. So again, they had a quick view of what the key stats were. Scrolling down to the bottom of the page under the title Quick Stats Overview, again, it's the same information, not in PDF format, but the same information. And as you'll see, it unfurls under headings that align with those presented in the conceptual framework that Heather presented, her favorite infographic. Also, a nice functionality of this part of the platform is the description button that appears to the right of each indicator, where when you click on it, you're brought to a page that has a description of the indicator, the measure, data source, what data we have available and what is ultimately presented in our data tool, as well as sort of basic information on the estimate calculation that is used. So while the quick stats have a ton of information, ton of stats, we absolutely recognize that a high-level national estimate is generally not going to be incredibly useful when we're talking about informing action. And so the data tool is really what provides a variety of options to access additional information and data. Multiple ways to enter the data tool, the tab at the top, or you may have noticed a few green buttons along the way that will take you directly into our data tool. Our data tool and the quick stats are both updated annually as with whatever data is available. Unfortunately, not all our data sources get updated annually, so not every indicator is going to be updated annually, but we are our plans include annual updates for whatever data is available at the time of update. And so just navigating through the data tool, along the left side is a series of drop-down menus. The tool is totally dynamic. So as you move through these different drop-down menus, you will see the graphic to the right will automatically be updated. Melanie and I did a quick run through this morning and you couldn't actually see the drop-down menu. So I'm thrilled to see it now. So as you'll see, as she flips through, you can identify the domain of interest, the indicator group of interest, and then you can select a specific indicator. And from there, sort of the key assets of the data tool is that you're able to select the data breakdown. We include for our indicators as many sociodemographic breakdowns as our data source will allow. So we're often limited by the data source, but the tool will populate a figure over to the right-hand side as you move through those different menus. Sometimes having a quick stats printed and next to you while you're doing this can help, because some familiarity with the tool and where different indicators are found is necessary to move through the tool. We've also added in some features to make the information and data contained within the tool easy to use. At the top, you can quickly either print the chart or save the chart, and it can easily be added into a deck or into a document. It includes the appropriate citation information at the bottom and the data source, so quickly and easily spit out that. You can also download the data table if you want to get the information out or get those stats out so that you have them for quick reference. Also down at the bottom of the page there is, again, the measure description, information on the specific data source in the year, as well as a suggested citation. So we really are putting this information up in the hopes that people will use it. And all we ask is that it be appropriately cited so that it can be referenced and people know where they can also go and find that information. So thank you, Melanie. Next, I think I was going to have, oops, sorry, that was my bad. Flipping over to the publications tab. Sorry, was the last part that we were going to explore in that, the data tool. And so the publications tab has a list of all our PMH related products and publications. It's actually updated, I won't say in real time, but we do update this tab as new publications, as new products are released. So it is updated more than annually. So feel free to check back regularly. It includes, among other things, our older quick stats documents. So again, those quick PDFs, you can easily find them for all our previous editions for both youth and adults, as well as links to infographics, data blogs, and data tools, not all of which are only using PMH-SIF data, but for the most part, all the products and tools here are using indicators found within the PMH-SIF as their basis. So they are also linked off of here. Great, thank you. And going back to the deck, the next slide just has a few images, a few of our key knowledge translation products, some older than others. The two on the right provide COVID-19 pandemic specific data, one being a mapping tool, the other being an inequalities and mental health data tool. So in the slide deck, you will find there are hyperlinks to all these tools, or that publications tab. Again, feel free to check it out and take a look at all the various products. So if everyone here is anything like me, you're probably itching to go poke around in the tool. So what we're proposing is to just take a break for 2 or 3 minutes. We'll pop the link to the info base into the chat. And we've just put a couple questions up here for people to explore, hopefully get a feel for how the tool works, see if they can find the requested information. No pressure if you don't want to, but just thought we'd pause for a couple of minutes to allow people the time to do that. If I can find the chat, I can pop that in there. Cool. I'm seeing some great questions coming in the chat too, so we'll definitely answer all those at the end. All right, I hope everyone's had a little chance to take a look there. We did also include as our next slide, for those who want to be sure they found things, we did provide an answer key in the presentation deck. So as you get through, you can check your answers there. All right, and we can keep moving. Again, I think we were going to do another poll, but perhaps we'll leave some of these questions to the end and would welcome people to chime in either at the end of this presentation, or we're always interested in feedback and and questions. And so asking, you know, what type of data or statistics do you need to better inform or support your work? And really the ultimate question we're looking at is the PMH-SIF data tool easy to use? Is it working well? But is it giving you the information that is important for the work that you do? If not, why not? What would make it work a little bit better or be more useful for your work? So moving on, what you saw today, I guess, is it was live. So as the way the PMH-SIF is today, in the future, both near and far, we are looking to update both the adult and the youth indicator frameworks again in 2024. So we're working on that update. A few new additions that are going to appear in that update include a key findings or a bit of a summary page to highlight what's included in the new update. There are also some new and updated indicators to get rid of some of the indicators that have been noted as being in development for a little while. We're also removing resilience from the list of individual determinants as we figure out where it is better placed, as well as a link to some of the another fact data tool, which is the health inequalities data tool for that indicator where resilience is being included. We're also adding additional data tool functionality. So actually the addition of the drop-down menu at the top of the data tool that allows you to toggle between different data years is new, and there is still one cycle of the indicator framework that has not been added. So we're working on ensuring that all our historical data has been added. We're also adding sex stratified estimates for all the PMH outcomes. And this has been a limitation of the tool for, well, really since its onset, was the inability to look at every disaggregation according to sex or gender. And so we're working to try and incorporate more of an SGBA plus lens into the data tool. And then again, adding some new breakdowns for the PMH outcomes. Again, some of our data sources are now allowing us to provide additional outcomes, and also looking at some trend data within there. A bigger piece of work on the horizon that we're actively working on is also the creation of a PMH-SIF for children. And so as Heather noted, the PMH-SIF work began with adults, then expanded to youth. At that point, it was determined that for children, more work had to go into creating a meaningful indicator framework for children. And so we're partway down that pathway now with a planned release for next fiscal year. So I don't want to go into details, but the development process does include both an academic scoping review as well as a gray literature review, and then consultations to help validate the results and the indicators for children. And so work is underway now. We hope to have the final indicator list complete by next fiscal year, so sometime after March 2024, for an inaugural children's indicator framework. To provide a bit of we are working to publish our process and our results, but at present we're at the data extraction stage for the academic scoping review. 45 full text articles were identified, and we're still expecting this number perhaps to increase a bit as we start checking reference list and do a bit of a snowball search. Just quickly what we found, or some things that we've identified, it has been conceptually challenging to define child well-being. There really is no clear consensus in the literature on definitions, and it is measured differently across various or different studies. Inconsistent terminology for the population, which posed many challenges in the actual lit search. So the term children is often used for pre-adolescent and even adolescent samples. And so we ended up again back in our youth sample when we really wanted to focus on those under the age of 12. The theoretical foundations in many of the articles that have been screened vary. Social learning theory, attachment theory, the different theories that vary across all the articles that have been found. A variety of themes and concepts, though, have emerged. Subjective well-being, life satisfaction, school satisfaction, friendships, home environments, family relationships. So a whole series of themes that have come out that have been in many regards similar to what we saw in adults, but definitely with a child spin to them. And so I think reaffirming the importance of having gone through this process for children in particular. And then we have identified thus far some measures that we are hoping will be useful for assessing child well-being, but we do foresee needing to do some additional work to determine their applicability in the Canadian context. So likely needing to do some validation studies, as we've done in the past in identifying indicators for the adult and youth PMHSIF. But we anticipate some of that work also continuing for the children. Next slide, please. Great, and so this is the final slide, just a few points about how the PMHSIF has been used to date. So first and foremost, it really has provided the foundation for our surveillance work over the last number of years. That includes informing our data collection, ensuring the consistency of our reporting. It really does provide a structure and a regularity to our reporting. We're not needing to think of, oh, how are we going to get a report out on such and such? It is possible to update the full set of indicators as data become available, and we at least know that the data is out there. And then we can dive deeper into certain topic areas, certain indicators with some of those additional knowledge products, those infographics, data blogs, as well as some of the deeper dive data tools that we have put out there. It has the PMHSIF outcomes have also been used beyond surveillance at the agency. So psychological well-being is actually one of the key performance indicators for the agency. And they've also appeared in the GOC, or Government Operations Center frameworks. It really has, the indicators have been used outside the Government of Canada as well. So they were used as an example of surveillance to support Ontario's medical health promotion guideline, and a number of jurisdictions in Canada have used the framework to guide their local surveillance efforts. And as Shannon mentioned at the start of the presentation, we're quite excited to see it profiled in the OECD report that's forthcoming. So moving on to the last slide, thank you to everyone for coming today and taking the time, and we are happy to answer any questions you might have. I also a huge thank you to Melanie, who has been working behind the scenes and was huge in putting this presentation together, as well as many others at FAC who've been instrumental in the development of the PMHSIF, the analysis of data, all the work that goes into to keeping it up to date and relevant. With that, I think we're happy to start answering questions.
Thank you so much, Heather and Karen. Hopefully you can hear me okay. I'm just switching between the chat box. So first of all, I just want to thank you both for the brilliant presentation. It was, I have a special interest in different frameworks, particularly those that measure positive mental health. So it's so fantastic to see something national in Canada that's so easily accessible for policymakers, practitioners, and the general public as well. So I commend you on that. We have a good few questions coming in. So I will kick it off with, there's a few questions actually about using the tool itself, and specifically looking at, are you able to determine intersexual identities? Like, is there the intersectionality of that? Is there a way to use the tool in order to determine that?
I would say at present, we're a little limited. Our addition of the sex and gender, again, depending on the data source, is really for us a big step towards that. It's been a bit of a limitation, but absolutely working, whether it's within the data tool or within our knowledge products, and ensuring that we are able to provide a better resource for that.
Brilliant. And then as well as that, there's just two questions here just about comparing data. So in terms of data breakdowns, are you able to compare differences between groups?
So for a lot of our indicator frameworks, we rely heavily if not exclusively, on comparing our confidence intervals. So conservative approach, as you may have noticed in the data tool, we always provide 95% confidence intervals for the estimates. That within the tool is really your only way to make comparisons between different groups or across years. We often discuss, should we be doing testing? Should we be checking? And ultimately, where that tends to break down quickly is the number of comparisons we'd be making. How many, where are we doing across? Are we doing up and down? What are we going to be comparing? And so largely in our surveillance work, though, especially at the highest level, checking A versus B, we typically often rely on that confidence interval comparison, and then go deeper dives or getting a little bit more statistically heavy as we're putting out manuscripts and putting in some of the more detailed products.
I can imagine just the scale of the data set that you're working with. I know that it might sound like an easy job, but there's so much behind that to really do that comparison. So we also have a check or a question about provincial or regional data and whether or not that's something in the pipelines, or is that something that you can check?
So the data tool, whether does or will, sorry, Melanie would know. I have to go check. I always forget. A lot of our other tools do have provincial breakdowns. So I think that if it's not there now, it is among the items that we are looking to add. Going more granular than PT within the tool gets a little bit cumbersome. So the Canadian Risk Factor Atlas is another data tool that we do have readily available. It's a mapping tool and does allow the breakdown. There are, I believe, 2 mental or 2 PMH outcomes are featured in that data tool, does allow to drill down to the health region level. In terms of whether or not the sources, though, so some of our data sources do allow for breakdowns at the health region level. Again, we're often limited by the data source. So if that was the question, it would depend on the indicator and the data source as to whether or not that breakdown is even possible. But again, within the data tool, we're moving towards ensuring at very least PT breakdowns are available. The more granular tend to appear in some of our mapping tools.
We have a question here just about the age for the child measure. So they're just wondering, what age is it for children? Is it under 12 or school age children or younger?
The initial intent was under 12, and I think as the review develops, we're leaning towards it's going to be more the school age children. Then again, the preschool age again brings in a whole other a whole other lens that needs to be applied. So hasn't been absolutely defined, but I would say we are moving more towards that sort of 5 to 11 age group than going down younger than into that preschool age group.
Great.
But we did not define that going in. We left it broad under sort of, and that's where that notion of what does a child entail, I think,
right,
or provide some interesting results that I don't know if I'd describe an adolescent as a child anymore, but the terminology came up.
Fantastic, thank you. I'm just going through the comments here. So we do have a question just in terms of the infographic, which I absolutely love. I think it's fantastic and so visual. But at the societal level of the infographic, there's inequities is defined as one of the factors. So the person is just wondering if this includes impacts of oppression, power, and privilege.
I'll let you take that one, Heather. I feel like I've been talking too much.
It's totally good. So when we originally developed the framework, inequities were considered a really important concept to capture. I think at that point, the agency was also working on our health inequalities reporting as well. And we had a lot of discussions about, so just like resilience, which Karen has mentioned as being one of the concepts that may be moving out of the framework. Sometimes it's hard to come to consensus on the definition of your concept and then translate that into an indicator. So for inequities, some folks who were part of the consultations about what was important, which included the Public Health Network, felt that inequities were important, but they were thinking more about inequities in the outcomes, but they still wanted to see it as a risk and protective factor in the rest of the framework. Coming from where I sat at the time and having done my PhD in social inequalities in health, I was thinking like inequities, oh, are we talking about something like the Gini coefficient, which allows us to measure the distribution of resources in society? Gini coefficient is probably a little bit too complex for something like this. So to date, Karen, Melanie, correct me if I'm wrong, we haven't moved forward with any specific measurement of inequities. And I think rather we continue to capture that concept as inequities and outcomes. So I don't know what it will look like in future sort of refreshes of the framework. But this is where, again, it's really important for us all to remember that conceptual frameworks like this are socially constructed based on our understanding at a point in time. And as we have continuing discourse about what we really mean, some things may change, and that's okay. Because it may be that really that inequities and outcomes was really what was most important to people, but they wanted to see it somewhere else. So does that answer the question a bit?
Yeah, absolutely. I think it is very challenging to, even with the protective and risk factors themselves, to even know where they sit. I did notice in the, even in the infographic, that violence is seen as an individual factor. And I know violence can also be pushed up that framework into one of a wider determinant or a community level determinant. So
yes, and I have to say, like, you know, you work on something and you're so in it for like, we were in it for 3 years, and now I've had almost 5 years of relative distance, and I look at it and go, oh boy, I really would have done that differently. And then I'm like, but you know what? It's okay. It's a starting point. And there's awesome people like Karen and Melanie who continue to carry it on, and we'll correct all of the mistakes we made the first time around. So that's
Well, evergreen.
very,
It's always supposed to be evergreen. And I think, like,
Exactly.
Heather, there is, like, if when you go to the tool now, there is still an indicator for inequality in the lowest in that society category, but it's in development. And I think every time we look at it, we think, not how can we measure, but how do we do it as an indicator? Like, what would the one measure be that we would put in there that would speak to inequality? Like, it again, that's the interest has been there from the get-go. There is, though, at the agency as well, right? We're surveillance applied research. We've got whole groups working on inequalities and the measurement of inequity, and bigger tools and more detailed examinations and data products that are focused purely on inequality examination. And so even if it's not coming out in this tool, there is absolutely work at the agency that's advancing that, and I guess not modernize the perspective, but the approach is different than, oh, we need a measure somewhere in this indicator framework that speaks to inequality. And so in our 2024 update, there's a couple indicators like that I think ended up in there, and the more we've looked at it and thought, how are we going to do this? And I think now it is that time to start refining the indicator framework as a whole.
well,
Thank you. I see Melanie just put the inequalities data tool in the chat. So that, again, different group at the agency. You'll notice similar look and feel. They're all built off the same platform, but a little more information.
That's brilliant. Yeah, I think just as you're like, it's so difficult, some of these factors to measure. So and as you said, this tool is constantly evolving, but I just think the sheer amount of work and thought that's gone into this. I've previously worked in Ireland a lot, that does a lot of mental health promotion, but to see this tool and framework with national data in Canada, I think is absolutely fantastic. So just on the report, as we tie this off in the last minute, there was a question about the latest report being post-pandemic. They just said, would the team have the latest report 2023 or post-pandemic? But I'm assuming, is the 2023 report out?
So 2023 PMHSIF is what is live, and it does include some data post-pandemic. Now, we're still waiting for a lot of our key data sources to have enough data to really speak to post-pandemic, but there is data in the current version that is since the pandemic began.
Fantastic. Well, we're just on time for the close. I think I will turn it over to Colleen now to close the session. Thank you, Karen and Heather.
Oh, thank you, Katie. Yeah. And I'm just going to take a few minutes to thank you, Heather and Karen from the Center for Surveillance and Applied Research for such a content-rich and informative webinar. Like the manner that you presented the PMHSIF, it doesn't actually roll off my tongue the way it does with you, was just so accessible. And that's not an easy task to do, considering like the complexity of the concepts that that we're talking about, and that was coming up to the questions, and also within the time frame of just really under an hour. But identifying the right indicators at the right time to form the best decisions and actions in an evidence-informed and measurable way for positive mental health is a key takeaway that I'm leaving the webinar with. And I think that many of our projects who are in attendance might also appreciate that point as well. So thank you. And speaking of the projects who are able to join us in the webinar today, of course, we always want to thank you from the Hub and from FAC as well. We so value the important work that you're doing regarding mental health promotion in your communities, and are always so happy that you join us for these webinars. So just a few very, very last Hub tidbits. As always, we want your feedback. So when you close the Zoom link, you will receive a prompt asking you to answer just a few questions for us. And if you would be able to do that today, would be so grateful. It will ask you if you would like to continue. So please say yes, because we would love to have this conversation continue as we journey through mental health promotion together. Speaking of webinars, we warmly invite everyone to our next webinar on October the 19th. The webinar will be presented by the Taibu Community Health Center, which is located in Toronto. And they're going to be doing a webinar that is so timely in our current culture, which is focusing on the intersectionalities and complexities of anti-Black racism, mental health, and COVID-19. And you won't want to miss this webinar, just like it was just like today, it was such a rich and informative one. So please join us on October the 19th. And last, I just want to do a call out. Please visit our website, kde.ca. We are constantly adding new resources, one of which is a video series highlighting the different projects right across Canada that was undertaken by some very energetic members of the KDE Hub. And these videos are just excellent. They capture the innovation and enthusiasm of those ensuring that mental health is happening and making sure that there's real difference that is occurring in the lives of so many. So on that note, we at the Hub wish you a wonderful afternoon, and we look forward to when we will meet again. Okay, take care, everyone.